New research is shedding light on the link between hearing loss and dementia. A decade-long study following hundreds of thousands of people found those treating hearing loss with hearing aids were able to reduce the risk of developing dementia. With more on this, I want to bring in CTV's medical contributor, Dr. Marla Shapiro. Dr. Marla, this is such an interesting study. I know we say that a lot, but boy, this one, the link between hearing loss and dementia, definitely worth talking about. What did the study find?
Well, about worldwide, we think that there's about an 8% increase in dementia associated with hearing loss, but we've never really had a study that examined this. This is a powerful study because there are over 400,000 people in the study, and it followed them from around age 50 or so over the next decade. And if we bring up the results, what you see is that in those people who had hearing loss but did not use a hearing aid, their risk of dementia was about 1.7% compared to 1.2% for people without a hearing loss, or if you had hearing loss, you wore the hearing aids. And that translates into about a 42% higher risk overall for dementia associated with hearing loss.
So what does this tell us then about the number of people who are using hearing aids?
So that's fascinating as well, because I know in my own office when I have someone that I'm talking to and it's clear they're struggling to hear me, and I say, really, let's do a hearing test and think about a hearing aid. So many people push back. Worldwide, only about 20% of people who need hearing aids wear them. In this study, it was even worse. Only about 12% of those diagnosed with hearing loss actually had hearing aids. So whether it's the acceptance of hearing aids or the cost of hearing aids or accessibility for hearing aids, we don't really know. But now hearing aids are coming down in price. They're over-the-counter options, which aren't as good as fitted hearing aids. But even when they control for things like loneliness, social connectedness, and depression, it did not remove the association between hearing loss untreated and that 42% increased risk overall of dementia.
Yes, because all of those things that you just mentioned, that you just listed off, are part of the experience,
right,
if you will, of having dementia.
Right.
Why is the number not as high? What can we do, I guess, to improve that so that more people are getting hearing aids? I mean, if you couldn't see, you'd get glasses.
Right. So, my grandson is hearing impaired, and he always says that his hearing aids are like glasses for his ears. So, and I look at this and I think, you're so little, but you have such good insight. And I think that that's part of it. If we can translate to our patients that we now have data that clearly says that if you don't treat your hearing loss, it will increase your risk of dementia. And dementia creeps up on you slowly. Over time. You begin to notice cognitive changes. So the fact that this is such a powerful modifier that's actually available and can be used is really important to be able to give this link to a patient, to somebody who has hearing loss, to say it's not about the aesthetics, it's not just about being involved and being socially connected because now you're hearing what's happening around you. It actually is important for your brain health.
Right. And I would also add, on a personal note, if you know someone with dementia, have them get their ears checked.
And I think that that's critical because so many people who do have that issue cannot necessarily communicate that they're hearing impaired or they're having difficulty, and it may in fact improve their situation. But in terms of prevention, this is such a powerful and available preventive strategy when you think about the fact that it accounts for so much dementia worldwide and it's something we can do something about. Important to get that word out.
Dr. Marla, thank you so much. Appreciate it.